There are almost 500,000 people in Minnesota right now who are uninsured.
A lot of people end up not having access to a primary care physician or a primary care clinic, and they go to the emergency room for their health care.
Healthcare is a basic human need. And as a basic human need, I think we as a community have to help each other be healthy.
Healthcare is complex, both in how do you access it. You throw the idea of insurance or government programs on it, it's very hard to figure out how to use it, when to use it.
The rules keep changing, so I think what we are is that we make it a little more simpler for people to understand the healthcare system.
Portico is seeing people of all cultures and traditions, all economic challenges, and then finding options for them at a time in their life when they really don't feel that they have a whole lot of options.
If not of Portico, I think I would have had a lot of problems, honestly. Because especially since we're not working enough to pay our bills, Portico stepped in where they helped me to get insurance for me and my family.
Yo soy una madre soltera, la cual necesita mucho de la asistencia médica que me ofrece Portico.
The idea for Portico came out of really seeing how people without insurance have turned often to hospital emergency rooms at the time of greatest need.
That's the most expensive kind of health care. There isn't any kind of a focus on prevention and early intervention.
It would be to everyone's advantage if we could put some of that investment that we use to pay for people when they become seriously ill, if we could use that investment to keep people healthy. That was the way that Portico came into being.
Portico, I think, has a very important role. It's kind of this intermediary that can build connections and collaborations.
We connect our clients to organizations such as low-cost clinics, other low-cost healthcare providers. A lot of people seem to get lost within the healthcare system, so we really provide that hands-on work, whether it be through the application process or once they actually have health coverage, we'll help them continue to navigate the system so that they get what they need.
Mis niños ahorita todo bien, no han tenido problemas de salud, todo está bien con ellos. Nada más yo tuve un chequeo físico apenas y un mamograma, y parece que me encontraron algo, pero estoy contenta con Portico. Me ayudaron y me refirieron con otras personas que me pudieran ayudar y me están ayudando. Y estoy muy agradecida con Portico porque no nos dejan solos, nos ayudan.
Portico was designed to look a lot like a health plan, and that was done intentionally so that people who haven't had access to health insurance coverage could become familiar with how that system works and at some point be transferred over to an employer-based insurance company.
We're able to focus on preventive health care and to eliminate people having to go into an emergency room.
We are all about prevention. And so the cheapest care is care that we can get in early with patients, that we can educate patients, that we can do preventative care instead of getting to the point where we've got emergency situations or deep infections.
Portico costs about $60 per person per month to cover them. So essentially you can provide a year's worth of coverage for an individual for about $800. I mean, there are many people that pay $800 a month for their insurance.
I think it's the care management aspect, the follow-up, the one-on-one commitment and counseling with the various participants to ensure that they aren't confused about where to get their care and they aren't confused about how much it's going to cost them, and that they get that care when it's needed and in the right place.
The more we can reach, the better we do for both the participants as well as for the health systems, as well as for government budgets and other people who pay the bills.
What we do as Portico as an organization is really, it impacts a lot of lives in so many different ways.
claro, me siento muy segura ya que he tenido varios beneficios y hasta ahora necesito mucho de la asistencia de Portico.
I want to thank Portico very much. I'm happy that our health bills have always been covered thanks to the fact that Portico had been a mediator between my family and the insurance company.